Hey, good morning, everybody. Nikki Burnett here, Taste Life Nutrition Radio, streaming live from the amazing KUHS Denver. Join us on KUHS Denver or on Brooke's Facebook page, Dr. Brooke, my own Facebook page. You can find us there as well. Taste Life Nutrition Radio. What are we doing here? We're talking to people who are the best at what they do, and that's what I love. You know, I was thinking actually when we came in, and we got to talk about the song that makes me happy.
Yeah.
We're always starting the show with Three Little Birds because when I'm not happy, this song just makes me really, really happy. So
we all need that.
We do. So, what do we do here besides bringing amazing people? We bring truth. That's really the goal here, is to bring truth to health and wellness, the understanding that everybody's unique. We want to have some fun, but we know that, the internet, people's opinions, even the medical world's opinions, media's opinions, which means virtually nothing these days, but it's so confusing. It's unbelievably confusing, and I didn't do my job and turn my music down. There we go. Okay. I'm confusing people. See? Every time I do something and mess it up. We got it going this time. Anyway, so what I love about being here and what I was thinking about this morning is, a lot of times you have to go way outside of your world to find the people who you think are the best at what they do. Mm-hmm. And I kind of am surrounded by the people who are the best at what they do. and I just love it to pieces. And I love you. Yeah. So this is Dr. Brooke Olsen. She is a physical therapist, but she's not your everyday physical therapist. And that's really kind of what we want to talk about today is physical therapy, what you might have experienced, what you can experience, what's real, what's not real. Again, it goes back to the whole theme of the show, right? We want to get out there what is real to the best of our ability. We all know science changes. It changes every single day, but we want to stay on top of it and just know that just because one person tells you, and I'm going to use this as an example because I think it's really important, that you have to have surgery and there's no other way, get another opinion, get multiple opinions, okay? And so that's kind of where we want to start. Well, first we got to start with gratitude. So then we're going to talk a little bit about, Brooke and who she is, Dr. Brooke.
You call me Brooke. I'm good with that for sure.
And then we'll get into, kind of the details about what we want to talk about, which is pain and what's true about pain and what's not true about pain and pain management. So what are you grateful for?
Oh my gosh. This morning I woke up. Yesterday was a little bit kind of cloudy, a little dreary and all that, but this morning that sunshine. It is amazing. I step outside every morning, and even if it's raining, snowing, whatever it is, because I like to get fresh air, and that sun and the birds chirping right now, I am so grateful for growth, for spring, and for sunshine. That's what I am grateful for.
Agreed. Yeah. We have neighbors who just bought chickens, little baby chicks.
Love.
And so at right now they're still in the house because it's been too cool to go outside. So I'm just in this little place in the dining room, but you're always hearing these little chirping little chickens. They're so tiny and they're starting to get big and get their adult feathers. Yeah, it's amazing. And so you're talking about the birds chirping. I'm like, that's awesome. I just love it.
Which actually reminds me, because every day I get a picture from my dad right now. He's got a herd of cattle at home, right?
Fun, yeah.
And so I get baby calf pictures every day. Because spring we have probably about, I think he was saying almost 40 heifers that are pregnant. And so every day I get, hey, little new calf. Yeah, it's so cute.
So fun.
Yeah.
Babies. I just love babies. Baby animals mostly.
Baby animals. Yeah. We like babies too.
They're great,
yeah.
But I really like baby animals.
I love that.
I'm going to tell you that this is a terrible thing, that I had something in my head earlier. I'm like, I'm really grateful for this.
What's up?
It's gone. No idea what it was.
You felt it and then it left.
I know, which is sad because I was really grateful for it, and now it's just not here. But I will say, kind of similar. I'm a spring, summer girl. Love the spring, love the summer. And with this big cold snap that we've had, I get a little frustrated, and I don't like being that way. Yeah. So, today makes me really happy. Tomorrow, Saturday is going to be beautiful. tank tops and flip-flops is really all I care about.
Same.
Yeah. I don't like sweaters. I actually intended to take this off, but anyway, I'm grateful for the sun, grateful for spring to come, grateful for the flowers that are coming out because they're so pretty, the tulips, and I've got some carrots left over from last year that are starting to poke up. I'm like, this is great.
Life is good.
Life is good. I
love
love
that.
it.
That's great.
Cool. Okay, so let's dig in a little bit to why we have Brooke here. She truly is. She's a good friend. We've known each other for quite a few years now.
Yeah.
I don't even
4
know.
or 5,
Yeah.
somewhere around there.
Something like that.
Yeah.
And you know, I know her. I know her work. I know. I have referred people to her, and actually, the whole group of us have referred people to her because she's amazing at what she does. And in my mind, she's not your everyday PT. And I hear in my practice, I hear people who come to me saying, yeah, I had this accident, or I had this, or I had that in the PT. And I'm not trying to, I hope this doesn't come off wrong, because it might. I'm not trying to diss PTs.
No, definitely.
At all.
Yeah.
You know, every industry has its, you know, downside. I don't know.
Yeah.
But, you know,
Sure.
sometimes, most of the time when we're going to a PT, we need more than a list of exercises to take home, right? We need, and that's why I love the practitioners who I know so well, because every one of us we bring to the table an individualized approach to care. And that's what Brooke does. But I really think that you go above and beyond.
You're making this sound really
No. So she told me a story. It's been a little while now, but she told me a story about a girl who she needed some PT, but she also wanted to run a marathon, or it was a 14er or something. She's like, okay, let's go do it. And so that's what she does, is she does it with them. And I'm like, you sporty people. I love it.
It's like a love-hate relationship right there.
Yeah, right.
I love it.
So let's talk about you and where you came from, how you got here, what motivates you, where you're going, what you're doing, all of the things, and then we'll jump into the geeky stuff.
I love that. That's a loaded question to
Yeah,
start off with.
I know.
Yeah, so I'm Dr. Brooke Olsen. You can just call me Brooke, obviously, but co-founder of the Physio Revolution here in Denver. And I actually came from, I was telling you about my dad already with the cows, right? So I come from a small town of maybe 40-some people.
Does that mean it's grown or shrunk?
It's shrunk. I would say it was like 52
Okay.
before, so we really went down. But I'm from a small town in South Dakota. I'm just a farm girl. Just kind of got myself into sports. There's really, in my life, there was really nothing else to do other than just kind of dive right into sports. So because of that, my nature and my background is injury. I would say just in general with my sister, she is amazing. She's 5 years older than me, and she suffered a stroke when she was 9 months old. And so I don't
think I knew that.
You didn't?
I don't think so.
Yeah.
Holy smokes.
Yeah, so she had open heart surgery when she was very young, and she has had a recent one, probably, what is it now? Almost 7-8 years ago now too, was her other one. So I've been around therapy my entire life, I feel like. Just in general.
Whoa, that's so intense. Is there a blood, I don't mean to get too personal,
No,
is there a blood clotting issue or something?
Congenital heart defect.
Okay, yeah.
And then just, young enough to deal with that stroke, and then just having the congenital heart defect. She went through multiple different surgeries, ablations, Fontaine procedure, you name it, all these rare things. She was kind of like, I want to say almost like a study case for like the Mayo Clinic in Rochester.
Interesting.
So she was one of the youngest to ever go through open heart at the time. So
good for her.
Yeah.
Sort of.
Well, she's here.
I mean,
and
that's what matters, right?
They said she
Another thing to be grateful for. Yeah.
They said she would only live till she was 13, and here she is. She's 5 years older than me. She's married. She's doing wonderful.
Good.
That's pretty cool.
Wow. Medicine is amazing.
Yes.
There are some things that we say that aren't so great, but medicine is amazing in what we have the ability to do with bodies.
Yeah, definitely.
Acute care. Cool stuff.
It's amazing. So I think that just kind of cascaded me into my own injuries, being around therapy so much, loving people so much. I think it's hard when you're such a server not to go into an industry that's more of like a serving based. And so I played collegiate level basketball, just really kind of put some havoc on my body in all the right ways probably. And then just ended up thinking about what do I want to do? How can I serve people? I thought about anesthesia at first. I thought about optometry, but then what really like came down to was having a relationship with somebody. So for me, when I
not much of a relationship with people in anesthesia.
No, like, good night.
Yeah, I know.
Night night. You know,
I
like,
hear it's hot.
Yeah, it is warm in here.
It's always warm in here.
So I think I think you can relate to that too. Like it's very important for me to have a relationship with the person that I'm helping.
Yeah.
And I didn't see that really happening as much as I wanted, but I saw it in physical therapy.
Yeah.
So
yeah, that's amazing. And so the Physio Revolution, you have a partner who owns the Physio Revolution with you, Miss Annie, who is supposed to be here as well. She's also PT.
Yes, she is.
But she's practicing CEO.
Yes, she is the manager. She's doing all the finance. She's doing all the behind the scenes stuff. I mean, the company itself would just not exist without her. So she's amazing.
Awesome,
really
awesome,
is.
Good stuff. And you're growing.
We are.
Yeah,
we're a team of 6. We started out in 2017. Literally just me. I think you remember this. I was just in a room and I was just sitting there thinking, how are we going to be able to help people? How are we going to get this message out, you know?
Yeah.
And so, it was just me at first, and then Annie came into the picture, and then from there, just seemed like the message was really catching, and people didn't want to go down a route of pills, surgery, you know, injections and all that stuff. And now the more that we've grown, we're a team of 6. I am so lucky to have 2 fantastic physical therapists with me that have the same mindset, the same beliefs, same core values, stuff like that. So we stole them from 2 different clinics in town here. And
awesome.
Yeah, and we're growing. We're growing at a pretty good rate.
Good.
I'm pretty happy with
that.
Yeah.
Good. This is a good time to grow.
Yes.
So that's amazing.
Yeah.
Cool. So let's jump into. I think first I want to talk about what makes you different, right? You know, again, you know, we were talking about. So often, I mean, I've done PT, it was a long time ago, but it was, you know, sitting in, you do some exercises, and that was kind of it. And it was in, and he I think it was him, stayed with me, and I mean, it was fine, and it worked. But I hear all too often, they just gave me exercises to do, to go home with, which is good too. I mean, we got to do our own exercises at home also. But what you do, and the care you take, and the time you put in is very different than what I think most people see. So talk about that.
Well, I mean, I just think of care differently.
Yeah.
And I think it's at the core of me to facilitate that for anybody who works for us as well, is they want the care to be different. So I think most people who have maybe experienced physical therapy before, like you were saying, will go there, they'll just look at your one spot. So let's say you have back pain, right? And everybody just looks at your back and they say, what's going on there? What exercises can I give you on a sheet of paper? Hand you off. We'll see you in another, like, you know, see you next week maybe, or see you in 4 to 6 weeks. Go do this stuff. And I think in general, a lot of PTs just really want to serve, and I think that we're restricted by a lot of things in that area. So time limitations, being passed off to somebody else, like that's just something I never saw going to be able to actually truly help somebody. So that's one area that we're a bit different on. I would say the other part is, like, we love to go the holistic route. So we think of it as a 5-part aspect. So it's, what is your environment like? What's your community like? Who are you hanging around with? What's your support system like? Also, can we be part of that? Can we be advocates for you? Can we push you? Can we support you in a way that you actually see changes? Otherwise, it's really hard to motivate ourselves. And we got all this external negativity happening to you. That's not going to be a good environment to be in, right? So what's that like? What's your fuel like? You understand that. When I have problems, I refer them off. I try to get them to Nikki as much as possible, because that's something that we can touch basics on, but we're not going to be the specialists in that. But at least knowing where there's a problem, being able to address that, because that's a huge part of healing as well. We also look at recovery. So for us, stress is a big factor. And I think even more important when you're talking about healing is sleep. It's one of the biggest parts that get missed.
It gets missed, and people aren't sleeping.
No.
I mean, nobody asks the question, and that's just it right there, is asking the questions. And it doesn't happen. It doesn't happen a lot in the allopathically trained, right? Which is kind of the Western medicine approach. So, but in a more holistic approach, you can call it holistic, you can call it functional. I mean, all works together. We don't work in a vacuum. We don't, our organ systems don't work in a vacuum. We don't work in a vacuum. Our energy, there's energy between the two of us. You know, nothing works in a vacuum, and we have to understand that everything's going to affect recovery. Everything's going to affect health. You know, so if your mind's not right, what if you've gone through this chronic pain, which can change mindset incredibly? It can really bring you into a depression. And so what if you're going through this for years and years and years and years, and you get to Brooke and you say, oh, it's just not going to work.
Yeah.
What happens then? Well, and I think Brooke can move past that. But the point is, are you actually going to truly heal if you don't believe you're going to heal?
That's a really good point. And I think that's another part, right? Like, there is a huge, of course we look at the body, right? As a physical therapist, I have to look at how you move. That's what we do really, really well. But there is a belief system deep underneath there. And we're impacted by traumas, and we're impacted by our environment and our current, like, critic inside of our brain.
Yes, that's a big one.
Right? And so if you currently have a belief that this is stuck, this is how it's going to be forever, I'm not going to find relief, or my parent had back pain, or my uncle suffered with knee pain forever and had a total knee, or whatever it is, and I'm doomed to go down that route. You almost think genetics, you almost start putting these beliefs in yourself.
Exactly.
Your body's going to, in a sense, give you what you're telling it that you want it to do.
Yeah, yeah.
So you do have to watch a little bit of that mindset. And I think that's where it all starts. For us, is just kind of looking at the person and saying, where are they in their journey to making a decision to do something about this?
Yeah, yeah, and I think too, and I say this a lot. You know, as we, you know, in life, we tend to blame other things. We blame life. We blame genetics. We blame age. We blame all of these things on whatever our issue is, the chronic pain or the GI pain or whatever's going on, the knee or the joint, you know, whatever that pain is, like, oh, I'm just getting old. Oh, and epigenetics, and oh, I'm just, you know, it's in the family, and it's just going to be me, and that's just the way it's going to be, and I call bullshit on it. I mean, it's what it is, because it's lifestyle, and it's what you put into it, right? So it is it's holding ourselves accountable to know what we need to do, find the people who can help us know what we need to do, because we're not experts in everything. But then when we get to that point, go at it and say, I can do this.
Yes.
I have found the people who know how to help me, and I can do it.
Absolutely.
Yeah.
I think the mind has a big control system for us.
Huge.
From a physical aspect, but it does start within that level.
Yeah.
I know of a guy who right now who is 72 or 73. He just turned 73. And he came to us probably over a year ago, and he said, my goal is to stay as active as I possibly can as I age. That's his goal, is to be able to travel and be able to walk as many miles as he wants in Denver during the summer, walk around Cheeseman Park. I mean, he wants to do the incline Manitou, right?
Nice,
and so, and he does it all the time with his partner, and they're amazing. They just have this mindset where they want to be healthy. And just like 3 weeks ago, the guy goes down, picks up a barbell off of the ground, and lifts 205 pounds. 72. 72. And I have a lot of people that go, well, don't you know my age? I shouldn't be able to do those things.
And that right there means, oh, well, you can't.
So we might be having some limiting beliefs that have to be challenged a little bit to say, and pain might stop people, and I get that.
Yes.
But moving past that, like getting through that level of, well, what is pain, and why is it happening, and how do we get down to the root cause of everything, and then propel yourself into an idea where, oh, I don't know, I thought I could maybe just learn how to sit or walk, and now my goals keep kind of getting a little bit bigger as I see the proof that my body can once again.
Yeah. So one of the things I think you were going to start with a little while ago, and then just came back to it, though, was the root cause.
Oh yeah.
So when you know, you were saying that, you know, there might be back pain, and so people give you exercises. Some doctors, PTs, may give you exercises for that particular joint in that area of the back, right? And that's kind of it. But what if that's not where it's originating?
Exactly.
Yeah.
I think what people have to understand, and what I hope that the listeners understand, is that there's a point where you have to look at it and say, well, why is pain happening in this area? And normally what's happening is that is where the stress is ending up, right? That's where you're getting stressed.
Yeah.
That doesn't necessarily mean that's the problem area. That's the part of the body that is where the pain is ending up. So it's originating probably, I would say over 90% of the time, from somewhere else.
Yeah.
Right? So the root cause in general is an investigation. You literally have to put on your
detective hat. That's what I say. You're a detective. You have to find what the problem is.
Exactly. Because if you just keep putting Band-Aids over top of things, if we just fix, the back and the back feels better, but we don't fix the real root cause of why the stress was happening there, then that thing is never fixed. And so then you continue to have episode after episode.
Yeah.
Right? And so root causes are kind of getting pushed aside, and we're just putting Band-Aids on symptoms. Which pain is a symptom.
Pain is a symptom, and so Band-Aids are going to be injections, right?
Yes.
It's going to be drugs, pain drugs, and how many addictions, and I'm not saying that really well, but are there with now these pain medications, but it's because people are in so much pain. And they're like, I don't know what else to do.
Right.
Because whatever I've done to date has not helped. And so what else do I do?
Right.
And you gotta, you just gotta find the right people, which isn't always easy to do, I think.
And medicine these days, and there are some great people out there, and I want to make sure that you guys know Nikki and I really adore the people who are doing good for other in the medical field. But there are some instances where people are kind of being pushed in and out, almost like it's just a factory mill, And the only way that they can do this based upon time is just kind of being like, oh, here's a pill, and we can do this with a quick injection, and oh, by the way, let's just grab a surgery, and that should probably help. And I think what we're not doing is looking at a person as a whole. Right? We're not taking into account that all these things are intertwined, and it's so much more complicated than just grabbing a pill or doing a quick surgery. Quick fixes are just that. You're gonna get a quick fix. But the problem is you're not getting a long-term solution. Because for me personally, like when I watch somebody move and you want to correct the back, that's fine, but you still have a crappy movement patterns. Right? So you go and fix the back, but your body still moves crappy, if not worse, after surgery. And then all of a sudden that stress ends up right there again. And so a lot of people, I think statistically, I was reading there's like a 10-year study that back surgeries just in general have a 10 to 46% chance of not working well.
I have a good example of that. It's a really sad example of that, and this is very recent. A friend of mine had, I would call it just a fusion, right back here. They go in here and have the, I don't know all the terminology for it, but it's the metal bracing, right, and they fuse it so he can't move. At this point, though, he has almost no use of this arm. So they go in to help his neck, and his pain in his neck, and he's an artist.
Oh no.
And it's his right hand.
Oh no.
Yeah, I mean it's a mess, and I mean they're gonna have to go in again. They're like, okay, well we squish this nerve, something like that. But you just pray that he's able to get back to work. I mean he runs it's his business, and it's so hard. And I think sometimes there's the thought, well, I don't have any other choice.
Sure.
Right. Yeah. And maybe that's the case in some situations.
There are some.
Yeah.
There's no doubt. There's people that are definitely warranted at a certain point when you've tried everything. Like I tell everybody, if you've exhausted every measure, you've gone, hell and high waters trying to find somebody, and you've had multiple opinions. But I'm talking about literally years and years of a journey of trying. This is not like, oh, I spent 3 months talking to a couple doctors. Right. I think that just in general, a lot of people aren't aware of what their choices are. Also.
Yes, no, I think that's absolutely true. I've tried PTs.
So narrow. Yeah, exactly.
I've already tried PTs.
So if I've tried a PT, I've tried them all. Right. It's like saying, I basically have tried white bread, but I really like, sourdough, but the Wonder Bread just isn't doing it for me. Yeah. It's like, that's because you're not having sourdough right now, and you enjoy that more, and that works for you, or whatever it is, probably a poor example, but it's just,
we don't talk about bread here.
No,
I'm just kidding.
No. I love that. No, but it is. It's like you're trying to say like, hey, I tried a nutritionist and I've tried them all. Yeah. And it's just not true. I think that there are people, and it's just in general that can really align with you. And if you can find that person that aligns with your same beliefs, your same understanding, and can actually understand your goals and be there through those, it's more than likely going to be something that is successful for you too.
Yeah, yeah,
you know?
yeah.
So
what is, and I know I've heard a couple of stories from you, a couple of really amazing stories. Just because I want to give everybody a really interesting example of a case that you've had where they have, whatever the story may be, they've been from doctor to doctor, or they've had the surgery, or they haven't had the surgery, whatever it is that sticks out in your mind that's a good case for people to understand what it is that can happen, and then what happens when they come to you.
I love that. Yeah, so I can probably think of 40 people right now, but I'm going to
That's amazing.
This was one of my very first clients when we opened up our doors, our physical brick and mortar, because when we started, we were kind of driving house to house in our vehicles. So
oh, nice. I don't think I knew that.
Yeah, just straight out of our car, we would go into the house and help people. But then my body was breaking down, so I couldn't keep doing that. So I got to take care of it.
That. Yeah.
So she came to us. She was in her 60s, late 60s at the time, and having shoulder issues, could not garden, could not sleep on her side, was having a poor time trying to lift up overhead, undo her bra for those women, right? All that stuff that just comes along with it, even just brushing your hair, simple stuff.
Yep.
Couldn't do this. And she had gone to PT before. She had a neck fusion back in the day, probably about, I would say that was probably 5 or 6 years prior to coming, and was really concerned because not only that, but she was having some back pain too. So it was shoulder, right shoulder, which is her dominant hand, and you talk about anybody, right? Yep. So once your impacted side, or your dominant side is impacted rather, it starts to just weigh on your life quite a bit. But on top of it, she was starting to realize that her family was expanding because her son was expecting. So she's going, how am I going to be grandma of the year, right? And be able to pick up this cute little grandbaby.
A lot of pressure there.
Right, and she gets to be able to watch him because they're local. And so she's going, what do I have to do? So she goes to the physician, sees the physician, and he's like, we got to do surgery on this. This is a severe rotator cuff. So it said on it like a moderate size thickness tear of X amount of, depth and whatnot. And she got the MRI and she called me up right away and she goes, oh no, this can't be good. Like, I am reading this and all these words don't look good, Brooke. And it's like supraspinatus, moderate size thickness tear, blah, 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 you name it. And there are all these foreign words to her.
Yeah.
Right? And so she calls me and she's like, I have to make an appointment with you. I don't know what this means and I think I need surgery. And I looked at it and I was like, the great news is that this is all common at your age. Like, this is all normal. And so we literally started working together, and we connected it to the back as well. And she's never had that surgery. She is now picking up her I think he's over 12 months now. He's adorable. We get videos of him all the time, right? But like picking him up and being able to take him over the crib and put them down. Yeah. She's like a garden queen, by the way, too. So she's like in her garden doing all stuff. And I'm like, in your 60s, and they were saying, this has to be done. And now she hasn't had pain for, my gosh, 9, 12 months in her shoulder. It's amazing.
I think that's such it. I don't know that I can speak to this boldly enough that if you're told you have to have surgery and you're just not sure, just look somewhere else. Or not look somewhere else, just get another opinion and just find out. And surgery's a big deal.
It's a big deal.
We don't want to be cut open if we don't have to be cut open for any situation. Some situations, as we already stated, are necessary, and of course, but whether it's joints or other procedures, I think that there are a lot of them that are done because people just don't know there's another choice.
Yeah.
And I see it in nutrition as well, like
definitely
gallbladder. There are more gallbladders removed that could be saved, and it's heartbreaking. Because what happens then? And I'm going to jump into my world just a little bit, because if you don't have your gallbladder, you're not breaking down your fats, which means you're not utilizing your fat soluble nutrients such as A, D, E, K, CoQ10. I mean, CoQ10 is so important for heart health. You have more mitochondria in your heart than anywhere else in the body. And CoQ10 supports your mitochondria. So if you've got this fat soluble antioxidant, you're not able to break down your fats, which means, anyway, so I'm going in circles here, but that's what it is. It's a big circle, and it's a problem. And so people end up with lots of GI issues. Nobody's ever told, okay, go take your digestive enzymes and take these things, that are going to help you to break down and utilize your nutrients, or you need to supplement these nutrients, So anyway, I totally off the wall there, but I can't help it because it gets really frustrating when there are these surgeries that just really aren't necessary, and I see it constantly.
It's so true. Going back to that low back surgery, here's this. I think that this statistic is just out of this world. So, low back surgery, 10 to 46% chance that it does work. After you have one, the second one has a 30% chance that it will actually work. Third surgery, 15%. Fourth surgery, 5% chance. So it tells us a lot of data in this science, and this is and same with your stuff. I mean, like, it is just so blatantly obvious that maybe we're overutilizing some things that probably are not beneficial to our human bodies anymore.
Right.
And I think we're starting to get on that path where other people are noticing this too, that, wow, maybe I do have the capability of healing, right? That inside, your body is just so robust. It can take so much.
Such an amazing piece of machinery. It's so fun.
It is. Yeah. And I think that from physical, internal, whatever aspect, mindset, you can help your body heal all these different avenues that it has within it too. And it doesn't have to go down the path of, well, my only option is surgery. My only option is to remove this thing and have to deal with side effects for this for the rest of my life. Right, we're not having to put ourselves in cages for the rest of our life because of this. It's rather, how can I open up my doors and learn about it at the same time? Because I think education is the biggest piece of knowledge, which is exactly what you're doing here, which is so amazing.
Yeah, well, and so are you. So Brooke and Annie have started a podcast.
Oh yeah, that's coming out soon.
So it's not out yet, but you're recording.
Yes,
is
we
that
are
what
recording.
I'm understanding? Okay.
Yes.
So see, that's what it's about, though. I mean, that's where we love to get the real deal out there, and what can actually happen, as opposed to this is the only way, this is the only choice, and you're like everybody else. So you have to be treated like everybody else. I hate that.
Just put everybody in a box.
Yeah, you're all the same.
You're all the same. That's not true. I've never treated, and I know you probably are the same, I've never treated somebody with sciatica exactly the same.
No.
Never.
Yeah.
And that's what frustrates me when we were talking about exercise. And I'm like, just hand them, it's just the same about probably diet. It's like, just hand them this sheet of paper. That's all you have to do. It's like, no. You have individualistic parts of how you're going to heal faster. That we can actually cascade or like get that ball rolling faster by being very much customized to each person.
You have to. I see a lot of GI issues. I see a lot of fertility. I see a lot of autoimmune. It may be the same. Well, it may be the same symptoms, but rarely is it actually the same thing. And so we've got to figure out what it is that's causing the symptoms. Even somebody came to me she called me. We do free consults. And she said, I just need to lose some weight. I was like, okay. She said, we were talking through it. And so her question was, so what do you ascribe to, if that's the proper terminology? So what kind of diet do you like? Like, for one, I don't like diets. We don't do diets here. But two, I don't know, because I don't know your body. I don't know what you need. So we haven't looked at labs yet. We haven't done any labs yet. I have no idea what it is that your body's telling me. Why can't you lose weight? Is it hormones? Is it an infection? Is it thyroid? It can be just all these things. But, everybody's like, I just need to lose weight. So, I've never, and I tell people the same thing, I've never, for any situation, have done the same protocol for anyone.
And the same goes for any other type of joint pain that you experience too. Right? Knee pain, bone on bone. A lot of people, no, you can't fix bone on bone, but you can fix the feeling that you have going up and down a stair. But that takes a very, very unique approach on each person to figure out which direction does the foot need to be, the hip need to be, how is the back impacting that? I mean, like, you just can't always have one size fits all. It just won't work. And we've seen it over and over.
Yeah.
Right? People try a diet, and what happens? 2 weeks they're off of it, and then they're like, I can't lose weight.
They're frustrated, or it works for somebody and it doesn't work for somebody else, and then it's,
Totally. It's the same in our realm, where it's like, well, I've tried these exercises. I found them on YouTube. I found a sheet of paper from my doc, you know.
Yeah.
And nope, those didn't work, so nothing must be able to help. No exercise that I do would be able to help.
Yeah.
And
so
that's
you must
just
have to have surgery.
Yeah. It's my only other option.
Yeah.
And I, you know, just in general, I hope the message is coming across that it's not your fault. I just want people to know that this is not your fault.
Yeah.
I think what we're trying to say is, in general, a lot of people have been maybe taught in a way that they don't know that there's something else that could possibly be out there for them.
Right. Yeah. It's hard to know. It's hard to know everything that's out there that can be helpful to people. And, you know, God bless those people who have the ability to find them and are, you know, helped by you.
By you.
Well, yeah, for those of us who practice the way that we do. And thank you. I need to, I'm being prompted. I need to Henry's always taking care of me, but I need to take a quick break and talk about Rightful. So Rightful is one of our amazing sponsors. They're a company, they're actually a pain management company, or the supplement is a pain management supplement. It's a really interesting supplement that there's a morning and there's an evening. It's coconut milk based, but it's curcumin is the main component of it, but it's the however they make the curcumin. I don't know what they do that makes it work so well, but it's in pain management clinics. Is how well it works. So the morning is sort of an uplifting, you know, adrenal support kind of focus, as well as pain management, and then the evening is kind of, okay, let's bring you down, let's calm, let's go to sleep. People sleep really well on it. But I love it for what it is. I love it for being a supplement that can help people manage pain while they're working with somebody like Brooke. You know, the thing that we want to understand with supplements is if you're having pain, understand why you're having the pain, and don't take it just to cover up the pain, because it's still a supplement and that's still what it's doing. We have to address the issue. But for reasons why you're trying to move through the process, and I use this example a lot, my husband Lowry has a fused ankle. Not a lot of therapy or nutrition is going to help a fused ankle. Yeah, it's done. So, you know, really good situation, or a supplement for him to take for, you know, when he has, because he still has pain, which is really frustrating. Yeah. But anyway, Rightful, you can go to rightful.com, put in the code TLN20, get a discount. It's a great, great product. So check it out. And let's keep talking about some fun stuff. I want to talk about, I think I want to kind of get into the chronic, you know, the chronic pain. You know, I don't know what it is, or it's just this consistent pain, you know, things like that. You know, I know you see that a lot. Can you give some examples? Can you talk about how you can work with people who have chronic pain?
Yeah, definitely. I think that's probably one of our specialty areas where we really help people who have tried everything and they feel completely lost as far as hope goes. That something would be able to shift for them. Chronic pain is very complex.
Yes.
In its nature. And I think anybody who struggles through it is a warrior also. I think truly it is one of the hardest things to have to deal with personally, because it's not just a physical pain, it's an emotional attachment to pain as well too, that there is, it follows you around all day. How could it not be emotionally draining for anybody? It is. You know?
And I experienced it, not myself, but with Lowry.
Sure.
So when he broke his leg, it was a really, really nasty break. But he just for, I don't know if it was 3 years, 4 years, something, just constant pain. And he's a very happy guy, and it really brought, he's pretty good. But it really put him into a depression, and not, you know, stereotypical. He was able to function and things like that, but it was really hard. And what was interesting about it, because this was 12 years ago or something, you know, but when we finally went to see a doctor about what we should do, I think it was our PT at the time who told us we probably need to think about going and getting it fused. This doctor said, this type of pain, and he said, he's like, this can put you into a depression, and both of us went, whoa, because that's exactly what was happening. But we didn't realize that that's where things were going.
Yeah.
It's amazing. It puts a lot on the brain.
It does. Statistically speaking, 80% of people who are in chronic pain do suffer with some level of depression.
Yeah.
So it is so common to find yourself in those feelings of lost hope, complete identity change too, because if you're somebody who's always been active, if you're somebody who's always been, going, and all of a sudden that stuff is ripped away from you, that's very hard on a human, right? So from chronic pain, just in general, and honestly, I dealt with it for 5 years myself. I went through what they called one of the worst spines they had ever seen when I was really, really young.
Really?
Yeah. So
many things that I didn't know about you.
I was 18. I was 17, and somewhere around there, and I was playing volleyball in high school, and I went up to go hit, and I ended up having shooting pain all the way down into my left side glute, into my calf, into my foot, and then I started to lose some level of function in my leg too. So I went and I saw the ortho, because that's what you do, right? Saw the surgeon. What do they offer?
Surgery.
First an injection, so I got that. But
definitely.
So I got the injection. That didn't really help. I just kept having these nervy pains. I couldn't even put on my shoes. I remember literally laying on the floor on my back, my mom putting pillows underneath my legs and just stacking it up, and I'd then get really uncomfortable, and then I'd have her move one, and that would hurt. I'd try to stand up straight, and I'd just have shooting pain. And they said I had a large bulging disc that was actually having part of the disc come out onto the nerve. And so I was having that problem, and what ended up happening was then they say go see a chiropractor. And so I went and saw a chiropractor, and it was just a little bit different of a chiropractor. And I was getting adjustments, and he was putting his full body weight on me and just slamming me. And so it was making it worse.
Oh my gosh.
It was making it way worse.
We love chiropractors.
Yes, definitely. There's some great ones out there. But this one wasn't really helping me.
That's a problem. Yeah, that doesn't... you just wonder
it was
how. Okay, sorry.
It was a bad experience. It was one of those deals where it just happens, right? And so I kept suffering, and I tried PTs, I tried everything. I was in the athletic training room all the time, but every once in a while, my back would just flare up. And so I was in what they said, a chronic state of pain, right? So that went on for 5 years, and it really wasn't until I found somebody, and I can see his face still today. Don't know his name, but he was amazing, because I was really young at the time. And it was a game changer. It was a total game changer. And I asked him what he was doing, and that's exactly how I got down into the route of wanting to help people with chronic pain too, because I've experienced it myself.
Interesting. So I'm curious what your thoughts are. And so this is kind of coming from my point of view as a nutritionist and dealing with inflammation a lot and, lots of inflammatory conditions. Your thoughts on people who have chronic pain and their diet. I mean, right? So we all know the answer to that, right? Food, the wrong food can exacerbate inflammation. It's just what it does.
Yes.
I mean, bad food is inflammatory, period. And so I would assume that in practice you see this where if you're eating a terrible diet, the inflammation and the pain is going to be much worse.
Yeah, definitely. I think, and I agree with you, and I think that's where it's it's also like if you don't sleep, you'll have inflammation too, right? So it's diet, sleep, stress, trauma, mindfulness, all that stuff, right? So it's a compound effect. But if you aren't looking at all those tools, right? If you're not taking into account that you are a whole human being, including like digesting, what fuel are you putting into your body? How is your body ever going to heal in a sense that it will feel some level of relief so you can start moving?
Yeah.
Right? So you can actually feel, I don't want to say normal because I don't like that term. I don't really believe there's a normal, but some level of normalcy back in your life that you once had.
Right.
Right? So fuel, as far as that looks, I call it fuel, you call it food, whatever.
Same thing, right?
Just put stuff in your mouth, eat it, and swallow it, right?
The right stuff.
The neat part is that we get a choice. Right? That's the cool part. You get a choice, and sometimes we really make some crappy choices.
We do. Even the best of us. Not that I'm the best,
totally.
but we all
the
make
best
the
of
best.
us, for sure.
That didn't quite come out the way I intended to, but we'll just go with it.
I love that. No, but if you're in a chronic state of inflammation, how do you expect tissues to heal?
Right.
Whereas, you know, your supply of nutrients is going to come to the tissue level and actually do its job, get out its tools, and fix things for you.
Right.
It's going to be very difficult, right? I mean, just study-wise, you can put somebody in a very terrible environment and their heart rate accelerates, and we know that they release inflammatories. And so it's not, you know, it's like, it's multifold. It's not just moving and exercising. Yes, I think that humans need to be strong. Right? I think that there's a level of, we need to be robust human beings because they live longer. We just know that, right? So strength is a part of that. But also, like, if you don't feel your body correctly, how are you going to make strength even happen? And how are you going to get to a point where you can feel like you want to move?
One of my favorite things, and I use this a lot because it just, it helps give people, because it did it for me, but a different view on food. Because food is fun, food is social, food, sometimes people hate it, you know, because, oh, food is no good for me, you know, you know, that love-hate relationship with food. But what we need to do is take that piece out of it and understand what food actually is. It is a language. The nutrients in food literally tell our genes and our DNA what to do. And so if we think of it as, if we're eating good, healthy, nutrient-dense food, it's speaking to our bodies, and our body's like, okay, I got this. I know what I'm supposed to do, whether it's build muscle or repair muscle or joints or bones. Fight off stuff. Yeah, exactly. But if we're eating foods that are you know, full of chemicals, you know, not enough nutrients, a dead food, then the body's like, I don't even know what this is.
What do I do with this?
Right? So then it does exactly that. It becomes very confused, and that's when we have what we call dis-ease, right? And so that's all disease is dis-ease. And it's coming from that inflammatory process, stemming very often from the foods that we eat. So just like you said, we have to have the right nutrients, the right food, and the ability to break down and utilize those nutrients, because I have people who are eating really well. I'm like, let's look at your GI. You're eating well, but you're not absorbing anything. And so exactly. So it is interesting because we want to, as best we can, you know, one of my favorite things when I'm working with people, especially the super chronic, is, and I have a few who've just gone out and done it on their own, but they build a team. Your team that can give you guidance in all of the different ways, because none of us are experts at PT, at nutrition, at mindset, at you know, meditation, at you know, all of these different things. Acupuncture, can't leave acupuncture out. But you build your team because these people can give you the best guidance, and then this team also can work together. So you know, and that's the goal. I mean, I think that's as best as we can get to, you know, perfect medicine, right? And helping people to be their best is finding the people who can help them be their best. I want to surround myself with people who can help me be my best. I mean,
well, exactly. If you're sitting in an environment where you're the best of the people surrounding you, you should probably second guess that, right? Because ultimately, most people love to grow. And so I think about chronic pain in general and people who suffer with that, and I think about how they long to grow out of it. And I think what you have to do is think of yourself and putting yourself in a circle or in a team, like you keep saying, that is going to help you climb out of where you currently are. And part of our job is to go down into that dirty, messy hole of what chronic pain is with you and slowly help guide you out, pull you out of that area. And it's not so simple as one thing. And anybody who suffers with chronic pain understands that. It is multifaceted. It requires a whole team to help you, but I promise you, it's super rewarding on the back end.
It's true.
There are some amazing stories out there of people who have successfully gotten themselves out of 10, 15, 20 years of pain. Even shorter stints of 2 to 3 years this has been going on. But they just needed to kickstart things in the right direction. They needed to get a multi-team approach. Mindfulness techniques, sleep needs to get better, nutrition needs to get better, and they need to learn how to move their body a little bit better too. So it is a whole team approach.
It is, absolutely. I need to do another quick break, talk about Zymogen, who I love. So Zymogen, since it's not, you're a little bit blurry, aren't you? Yeah, he pulled it up a little while ago.
Oh, my fault.
No, it's not your fault. Yeah, there you go. See?
Nice.
He takes care of me. So Zymogen is a great company. I love them because of the data behind their products, and their products work really, really well. So I will say they're not the only company that I use, the only supplement company that I use, but they are cutting edge. They have amazing resources for both the practitioner as well as the practitioner's patients / clients. And they're really supportive of functional medicine, natural health, and they're just a great company. So these are a couple of the products that I love. I actually think they're out of the ketonics, which makes me really sad because I loved ketonics. It was a keto supplement, and I felt that's why I put these up here, and I'll probably change it out now, but the ATP Ignite workout and the ketonics together was like a focus machine for me.
Love it.
Yeah, it's really cool, and so I keep looking. I'm hoping it's just temporary, but so the ATP Ignite, my husband likes to take it before we work out. It's a great one too. I love it. It's got a little caffeine in it, but the way that I don't know how they do this, but the process, the caffeine, it's not a spike, and it's just kind of gives you that focus and that energy, and so it is great for workouts, and it's building ATP, which is what your mitochondria produces for energy. So just a good company. You can check them out. Go to my website for this one. Go to tastelifenutrition.com. It's Zymogen, but their order wing, I guess, is Whole Scripts. So you can get a discount, put in Radio 5. Check them out. Remember, don't just take supplements just to take them. Know what you need. Know why you need them. Don't just order them just because I said you get a discount. Know why you need them, but know that they're a great company. Okay, so I think at this point we've covered a lot of stuff, but what we haven't talked about yet is this. Look at that. I didn't even know you were coming out with a book. I'm like, whoa, Brooke has a book.
This whole state of the nation and world in this past year just kind of bought a little time. So this past year we were sitting in here's Annie too, so everybody can see her.
I love that picture.
We just decided to write a book.
Yeah.
We just took time out of our day, every day for the past year, and just put it all together and kind of put it inside of a book. So
cool. So let's talk about the gist of the book.
Yeah.
I mean, I know the title. So
sure. Aging happily without pain, right? Yeah. It's also just, for us, it's the ability to help somebody who's been struggling in pain for so long. So a lot of people who struggle with chronic pain, or what we call kind of surface level pain, where it's just sitting dormant and it pops up, and then it goes away, and sits dormant, it pops up, it goes away. And that's almost a level of chronic pain too. So it's really for those people who are struggling, who are looking to get out of pain, find solutions. We also talk about the methods that we use in here that is much different from a lot of people.
Yeah.
And then at the tail end, we have the holistic approach. So we talk about the 5 parts of the mind, body, fuel, community, and recovery, and touch on points with that, with tips and tricks on what you can do and all that. So it's kind of a all-in-one kind of book. It teaches you about back pain, knee pain, shoulder pain, neck pain, the holistic approach.
So, my understanding, basically, somebody can jump into that book and say, I have knee pain, so they can go to that section of it.
Totally. Yeah, you'll start out at the beginning because in our world, everything's connected.
Sure.
So even though you have knee pain,
in everybody's world, believe it or not,
it's all connected. So I would say even if you have knee pain, you'd want to read kind of the back section.
Sure.
You'd want to read the knee and the shoulder and the back and all of them. Like the whole book is kind of the connected piece to all of this. So
awesome.
Yeah.
So tell me real quick, because you said it gives some examples of things that you do differently.
Oh, sure.
What is that?
Oh, good. Well, we already talked a little bit about it, like that holistic approach.
Yeah. I think you said techniques, and so I was just curious if there was something that...
Totally.
Okay.
Well, one way that we look at somebody is trying to use like what we call a test-retest method. So, Nikki, if you came in and you had back pain, right? We would find out, or kind of like poke the bear, if you would. I got to figure out where it's coming from.
Yeah.
Right? That's what our team does, is we figure out where it's coming from. So root cause isn't always just the back, but we got to look above and below. So we start to look above and below and poke the bear, and so we have some data. We always want to collect data because data can't lie, right? And so we have that from you, and then basically what we want to do is we want to put together like this formula, this special formula that we're going to say, maybe that's some hands-on techniques from us, maybe that's a certain exercise or a drill that you can do at home. And then we're going to go retest the thing that we poked the bear with. And if that's not headed in the right direction where it's less pain, well, that formula didn't work. Right? That's why we're always looking at the formula that we put together. Okay, I moved your bones this way, or I did, this to your muscle, and we worked on this, this, and this on this area of your hip or this area of your mid-spine. And that formula better be heading in the right direction. I think what we see a lot of is, oh, you've got back pain? Do these exercises. Good luck. Adios. So our whole thing is like, there has to be proof of concept. And if there's not proof, why would I give it to you to go home with and do on your own? Right? So that's one technique that we can do for you as far as like what we do. But there's also that holistic approach of like, how do we take on sleep? How do we manage that? How do we get you in a sleep routine that works for you too?
Yeah, it's so important. But I love that because that's, data it's almost the most important thing. I mean, and so that's why I do functional lab testing. Is I need to. Somebody says, okay, how can you fix me? Like, I don't know. Let's look at what your body's going to tell us.
Right. What is your body telling us?
Yeah. So that's what I like. It's like numbers on a piece of paper just means your body's telling us what's going on.
Totally. And I think not to get confused because a lot of people come and ask, do you need my X-ray? Do you need my MRI?
Sure.
So that to me, like that's an image insight and that's a moment in time, like I tell people. I don't know, it makes me think of this time where I was talking to somebody and they were like, oh, I have bone on bone in my knee. Well, tell me when it hurts, because I want to listen to when your body is telling you that it hurts. Well, it's stiff in the morning, feels really good throughout the day, doesn't bother me, and it really bothers me at night. And I'm like, so, if we look at the image and they're like, well, it's because I have bone on bone. So you're telling me we have a bad image in the morning if we took an X-ray in the morning, and then we have a really good image in the afternoon, meaning like no bone on bone in the afternoon, and then it goes bone on bone at night. It doesn't make sense. Right? So we are not our image necessarily, not always is our data coming from an MRI or an X-ray, but our data is coming from what is our body telling us and what kind of threat signal is it giving us, which is a symptom of pain. Right? Where is it perceiving threat and why at what point in the motion? So that is something as well I think is really like important for people.
So what came of that?
What came of what?
So why was there pain in the morning and the evening, not during the day? Do you remember?
Well, multitude of ideas on that as far as that person goes, if I'm thinking about her. It was more of this idea of like, as in the morning, stiffness happens just because we're sleeping and we're in a stagnant position. So the joint didn't feel very lubricated. So immediately we want to get them lubricating the joint right away. So that feels better in the morning, not just in the afternoon. Right? So lubricate the joint. Feels good throughout the day. But using it, the capacity was so low that it wouldn't, like muscles wouldn't structurally hold it in place. It became painful because everything was compensating. So other areas were trying to hold that, right? Where there was like some sleepy, dormant coworkers that were sucking in there, right? So the coworkers, we kind of were like, hey, we gotta give them a kick in the, and get them to build up some strength. Once you get that capacity growth, then you don't have that struggle at the end of the day. So it's not the image. Right?
It's
interesting.
I love it. That's amazing. And we're at the end of our time.
Oh my gosh.
I know. It goes so fast, doesn't it?
So fun.
I know.
You're amazing. What you do for people, I think, is probably not recognized enough. So thank you so much.
Thank you.
I think things like these where you can educate somebody, you can really help them. Nikki's doing amazing things for quite a few people. I know.
Thank you.
Yeah.
Thank you. Well, this has been super fun, and just bringing, again, and I can't say it enough, but bringing people here with me who I truly believe are the top of their game. They're the best of the best. There are a lot of good people out there and really good at what they do, but when it comes to bringing the holistic approach, bringing the functional approach, looking at the whole body and understanding as much of that person as possible is key to really helping someone to truly heal and repair. So I'm super grateful for you. Tell everybody where they can find you and get your book and all of the things.
Yeah, I'll give a little show here once again. So Aging Happily Without Pain is on our website. You can find that at www.thephysiorevolution.com.
Mm-hmm.
So
it's my favorite name.
Yeah, it's the longest tongue twister.
It's great though. The Physio Revolution. I just think it's amazing.
And we're just trying to revolutionize physical therapy.
I know. It's awesome.
Thephysiorevolution.com. You can find us on Facebook. For those of you who joined us live, thanks for being here too.
Yeah.
That's us.
All right, awesome. Well, thanks everybody. I am, again, Nikki Burnett. Taste Life Nutrition is my company, functional nutritionist. You can find me same, Taste Life Nutrition, everywhere. That's all it is. Just look for Taste Life Nutrition, and I hope I'm the only one who comes up. I do have, though, for those who have any interest, I have a free assessment on my website that you can fill out. It comes straight to me. I personally will reach out to you because that's what I want to do, and I want to talk about what we might be able to do to give some guidance if that's what we need, or if we need to set up an appointment, then that's what we do as well. But just reach out, let us know if you have comments or questions. You can always post them. If you're on the Facebook group, you can always post them below. We're both posting this, so it's on the Physio Revolution Facebook page as well as the Taste Life Nutrition Facebook page. So we're here, and that's why we want to be here as a resource and to you know, be a guide, be information, whatever it is that we can be for anybody who needs it. So I hope everybody has a wonderful day, a wonderful weekend, and we will see you in 2 weeks. I need to slow down. Bye everybody.